Hello and welcome to Askimo TV. Talking today to Dr. Haysmith. Dr. Haysmith is an ophthalmic surgeon and clinical lead for macular disease and uveitis at the Luton and Dunstable University Hospital Foundation Trust. Hi, Dr. Haysmith. How are you?
Hello there.
Dr. Haysmith, let's talk today about the use of anti-Veg-f agents for diabetic macular oedema. So I want to start off with, what is diabetic macular oedema?
Diabetic macular edema is one of the problems that people with diabetic retinopathy suffer from. And in simple terms, it's when the central part of the back of the eye, the macula, becomes boggy and full of fluid. It's the result of the systemic problems of diabetes, where the small vessels that keep the blood supply to the back of the eye become leaky, and they leak extra fluids and fats into the back of the eye, and this results in cystic changes. And those cystic changes reduce the visual acuity of the patient, sometimes quite significantly.
What are the signs and symptoms of this condition?
The signs are seen by ophthalmologists and opticians, and they can see the thickening of the retina, often accompanied with other fatty changes and sometimes hemorrhagic changes at the back of the eye, that's little spots of blood. But the patient normally notices a reduction in their vision, and they notice often a graying out of their central vision, and it can be quite disabling to them.
What are the risks of this condition if left untreated?
Left untreated, it can progress onto incurable reduction of vision. And as with all diabetes, it's important to treat early and promptly if you're going to maximize the vision. Diabetes remains the most significant cause of preventable blindness in the Western world, and should not be underestimated in any extent.
If I have this condition, what treatment options are available to me?
Well, for the last 20 plus years, the mainstay of treatment has been the use of laser. And laser has been proven to be effective, and most ophthalmologists are very comfortable with the use of laser to treat diabetic retinopathy. Diabetic maculopathy has traditionally been treated with specialized grid lasers in the central area. These are always technically difficult because you need to treat the area of disease without damaging the fovea, the tiny spot right at the center of the eye, which is essential for reading, watching television, recognizing people's faces. And the high acuity vision is concentrated in this very small area, which we're always trying to protect. Laser doesn't really improve vision at all. It normally helps steady things, although there are a few people who are fortunate and benefit from an improvement in vision. New treatments, however, particularly the use of anti-Veg-f agents, that's vasoendothelial growth factor agents, are proving very effective at reducing the amount of swelling of the eye and actually improving people's vision significantly. And we now have a range of large trials that show us that this is probably the best way of managing diabetic macular edema, at least initially. And very fortunately, in the UK where I work, NICE, which is the main gatekeeper for expensive drugs, has also agreed that this is a cost-effective and safe treatment. And I am very excited that within the next week or so on the NHS, I'm going to be able to start to use these agents.
Dr. Haysmith, is it possible to prevent diabetic macular edema?
It is, in as much as it's possible for anybody with diabetes to control their diabetes well. There have been two very large international trials that were done that show that tight control of diabetes definitely reduces your instances of diabetic retinopathy. And in addition, there's a big trial done in the UK that showed that furthermore, tight control of diabetes with good control of blood pressure also significantly reduces your chances of developing diabetic eye disease.
Thank you, Dr. Haysmith. Thank you so much for talking to me today.
Pleasure.